You don't get a pick who you get grouped up with. It just happens.
Because I certainly would have chosen different people, right? All right, I'd like to introduce the Three Musketeers, or the Three Amigos, or the Three Stooges. No. Okay, let's see. Who was first that morning? Was it Dr. Pepper?
I was first.
All right.
I'm Roy Pepper. I'm a chiropractor, so that makes me Dr. Pepper. And now I'm Diet Dr. Pepper. I was supposed to have a Roux-en-Y gastric bypass down in Mississippi. That's where we live. Back on January 3rd, and somehow or another, it just things. I guess the good Lord kind of brought me to Dr. Rutledge, because the surgeon that was going to do the surgery canceled the surgery, and I kind of got upset with him and did some accelerated research, and decided that this was a better procedure for me anyway. We got here. The nurses were great. The doctor was great. Really, the only I've had a few little problems. I had diabetes. I had hypertension, sleep apnea. I haven't had any medicine for my diabetes. No Evandril or Fortimed. I haven't had any blood pressure medicine. It's running a little high, but today my blood pressure was the lowest it's been so far since I left the hospital, so that's looking good. I guess we did have a little bit of a problem, or I said I didn't. I was laid out on the table, weren't aware of it. But I had 7 ports instead of 5. I've had some other surgeries, and I guess the omentum, the fat covering the abdominal wall, was a little difficult to get into. We were going to try to do 8 feet. I say we, Dr. Rutledge was. We were only able to do 7 feet, but I think that's probably going to be fine. As far as the anesthesia, the effect of the anesthesia, I bounced back. I had more comorbidities in this bunch than anybody did, and I did best out of coming out of the anesthesia. But I bounced back real quick. I'm only having one problem, and I need to discuss it with Dr. Rutledge afterwards, is that I am having some severe right ankle pain. And I don't know, I don't have any problem
have you ever
account for it.
You ever had gout?
Well, that's been the question, but I've never had it. But
one of the things about gout is we do tend to cure it. We cure people with gout. That's the good news. The bad news is they usually get one last gout episode right after surgery, and it's awful. So I hope is it hurting?
You should have seen me. We went to a show last night, and I should have been in a wheelchair.
Well, you may be getting gout. Do you have a medical doctor that we can contact? Because we usually ask for their help and advice on this, and it can be a son of a gun and take a couple of weeks to get over, and it's awful. So you want to get on top of it. They tend to use what we call a medicine called colchicine, but a lot of times people who are diabetic and overweight and with high blood pressure often have gout, whether it's been diagnosed or not. And the reason the gout flares up after the surgery is because of the massive metabolism of muscle, which burns up the nucleic acids in the muscle cells to uric acid, and that causes a flare. Now the good news is, after going through all this, you'll probably never have gout again.
It really is very painful.
Yeah, it's
this is. Yeah. I mean, I had gallbladder surgery a little over a year ago, and not that it was difficult to get through, but this has just been a walk in the park. I mean, it's every time I would hit that call button for anything, the nurses were boom, they were there. The biggest problem I had was babysitting Scott. He fell asleep on the toilet.
That was the first 30 minutes I'll never get back.
Okay, I think, Scott, do you want to defend yourself here and introduce yourself and tell us a story about Dr. Pepper?
My name is, and I started looking into the surgery probably about 3-4 months ago, and I was all ready to get a lap band, and during my Google search, the Mini-Gastric Bypass came up, and when I went down that road looking at it, it was just like, I'm glad I found this, because I was going to go get a band. Well, I'm glad I did. He bypassed 7 feet, and apparently I didn't really have any problems with the surgery itself. I got a mild fatty liver, but I had slight hypertension when I came in. I got nothing now. Fell to 0. I haven't had a high blood pressure pill since the day before the surgery. So thank you for that. No pain in the incision area. I just like you back there. I get a shot right here, so it comes and goes. So I'm sure it'll work out now.
Yeah, that's going to gradually get better.
Yeah. Right away, I mean, I didn't come out of the anesthetic too well, as I guess. I don't remember a thing.
He was ordering a pizza.
He was talking. Yeah. Oh, boy. Yeah.
I need some dogs.
He asked the nurses to order him a pizza.
Yeah.
I guess the anesthetic makes you dry and chatty, I guess.
You're always like that. Come on, don't play about it.
Yeah, I am a little bit, but I don't actually remember talking to you. I saw your face for a moment, but they give you some ice chips for the dry throat, and everything else is pain meds and happiness, and no big deal. I think we walked about 10 good long walks during that first night.
Every time somebody needed to go to the bathroom, we just went and got each other and walked around.
Yeah, we'd go down, pick them up, get them out of bed, go for a walk.
They came to each room and said, "I can't quit you."
Okay. Well,
Yeah. Hard to defend yourself in one of those gowns, too. I really don't know what else to say. I haven't had any problem at all. I mean, we got out of the hospital on Friday, and we went and saw a show, and Saturday we all went for a helicopter ride, and I mean, we're up and going, and it's no big deal at all.
Why did you call us and ask us to go?
It was a small helicopter.
It was at capacity.
We actually had to see that, though. That's what you did.
Yeah.
I mean, he was hurting so bad last night with that gout. A guy in a wheelchair got up and offered him a seat.
And he said, "Dr. Rutledge did this for me."
I was going to try to pin this on you somehow.
It is. It's me. It is. Yeah.
But I've lost 23 pounds. Since 5 days.
Right.
So I won't even be here next week. I'll have disappeared.
It's half price on the helicopter ride.
I'm hoping that's all just water, and I'm not just going to go the other way and need a revision in 3 weeks. But so anyway, thank you for giving my life back.
Great.